Welcome back to our channel. Today's video is about schizophrenia, its symptoms, misconceptions, causes, and treatments. Imagine looking at the world around you, but reality feels different, almost like you're seeing and hearing things that others aren't. For many, this is what life with schizophrenia can feel like. In today's video, we're diving into one of the most misunderstood mental health conditions, schizophrenia. We'll break down what it is, explore some of its symptoms, discuss what we know about its causes, and address some common myths surrounding it. Schizophrenia is a serious mental disorder that impacts how a person thinks, feels, and behaves. People with schizophrenia often seem like they've lost touch with reality, which can be extremely distressing for them and for the people around them. It's more common than you might think. Schizophrenia affects around 20 million people worldwide. Let's talk about the symptoms of schizophrenia. These symptoms are typically divided into three main categories: positive, negative, and cognitive symptoms. Number 1. Positive symptoms. These are symptoms that add to the person's experiences, like hallucinations and delusions. Hallucinations are when someone sees, hears, or even smells things that aren't there. Delusions are strong beliefs that don't align with reality, like thinking they're being watched or that they have special powers. Number 2. Negative symptoms. Negative symptoms are things that are taken away from their experience. This could include a lack of motivation, reduced speaking, and even difficulty in finding pleasure in everyday activities. They may appear emotionally flat, almost disconnected from the world around them. Number 3. Cognitive symptoms. These symptoms affect memory and thinking. A person with schizophrenia might have trouble focusing, organizing their thoughts, or even making basic decisions. This cognitive impact can make daily life incredibly challenging. Moving forward, let's talk about the misconceptions revolving around schizophrenia. There are a lot of myths about schizophrenia, so let's clear some of them up. Myth 1. Schizophrenia is a split personality disorder. This is a big misconception. Schizophrenia does not mean having multiple personalities. Instead, it refers to a split or break from reality. Myth 2. People with schizophrenia are violent. This is another common myth. Most people with schizophrenia are not violent or dangerous. In fact, they're more likely to be victims of violence than perpetrators. Myth 3. Schizophrenia is untreatable. While it's true that schizophrenia is a lifelong condition, there are effective treatments available that can help manage symptoms and improve quality of life. So, what causes schizophrenia? Scientists are still learning about what exactly causes schizophrenia, but they believe it's a combination of genetics, brain chemistry, and environmental factors. Number 1. Genetics. If you have a family member with schizophrenia, you may have a higher risk of developing it. But genetics alone aren't enough to cause it. Number 2. Brain chemistry. Researchers have found that certain chemical imbalances, especially with dopamine, may play a role in the symptoms of schizophrenia. Number 3. Environmental factors. Certain factors like prenatal exposure to infections, malnutrition, and even major stress can trigger schizophrenia in people who are already at risk. Moving forward, how is schizophrenia treated? Living with schizophrenia can be challenging, but treatment can make a huge difference. Treatment usually involves a combination of medication, therapy, and community support. Medication. Antipsychotic medications are often prescribed to help manage symptoms, particularly hallucinations and delusions. It can take time to find the right medication and dosage, but many people find relief once they do. Therapy. Cognitive behavioral therapy, CBT, is commonly used to help people with schizophrenia. It can help them manage symptoms, improve social skills, and even cope with the day-to-day challenges of their condition. Community support. Many people benefit from having a strong support system, including family, friends, and support groups. This can help reduce feelings of isolation and make it easier to manage the ups and downs. Schizophrenia is a complex condition, but people can and do live fulfilling lives with the right support and treatment. Many people with schizophrenia go on to have successful careers, meaningful relationships, and fulfilling lives. Thanks for joining us to learn about schizophrenia. The more we understand, the more we can support and empathize with those affected by it. If you or someone you know is experiencing symptoms of schizophrenia, remember that help is available. Speak to a mental health professional or reach out to a trusted person in your life. Don't forget to like, subscribe, and share this video with someone who might find it helpful. Let's break the stigma around mental health, one video at a time.